As Nigeria joins the rest of the world in commemoration of this year's World Pneumonia Day, the federal government has expressed commitment in the implementation of Global Action Plan for the Prevention and Control of Pneumonia. The Minister of State for Health, Ekumakama Joseph Nkama, represented by Director Child Health Stella Onwosu, disclosed these at the ministerial briefing on the occasion of the World Pneumonia Day 2022. Benedict Uku has more on the story.
Pneumonia is an infection in one or both lungs caused by bacteria, viruses, or fungi. The global health community has mobilized swiftly against other diseases, but attention has not been prioritized towards the reduction of pneumonia-related morbidity and mortality. As Nigeria kicks off its Awareness Week, the Federal Ministry of Health has shown commitment to implement the Global Action Plan for the Prevention and Control of Pneumonia. The Minister of State for Health, Joseph Nkama, represented by the Director Child Health, Stella Onwosu, said that this initiative will be implemented through the development of the Nigerian Integrated Pneumonia Control Strategy and Implementation Plan,
with a view to further improving the capacity of health workers on pneumonia care at the facility level. The Ministry, in collaboration with the Pediatric Association of Nigeria and the Every Breath Count Coalition, developed an inpatient pneumonia treatment algorithm. No doubt, childhood pneumonia remains a neglected infection. Policymakers and program planners at national levels and international donors have paid less attention to the menace of childhood pneumonia. Curative services remain extremely limited and even unavailable in most places. A review of the country's status in the implementation of IMCI showed that just only 10% of health workers managing children are competent in the use of the strategy. As we commemorate this event, I urge you all to adopt and implement in detail all the outlined priorities in the National Pneumonia Control Strategy.
The representative from UNICEF, Peter Bafo, noted that access to primary health care is necessary in the prevention and tackling of pneumonia.
Many of the children who are at risk of these factors are also the children who are likely to miss out or unable to access quality health care promptly. To use some of the results of the Multiple Indicator Cluster Survey 2021, which was just disseminated, we know that just about 39% of children who manifest acute respiratory tract infections actually get advice and care from the appropriate quarters. So clearly, we know that these children who are at risk also miss out when it comes to care-seeking opportunities. We are therefore clear in our minds that access to quality primary health care is critical for both prevention and prompt diagnosis and management of pneumonia among children.
The representative of the Pediatric Association of Nigeria, Oyinagi Oluseyi, disclosed the need for community health strengthening and access to key life-saving alternatives.
The current situation, where Nigeria contributes the highest number of global pneumonia child deaths, requires urgent action, which we're glad to see that the ministry is taking. All key stakeholders in the pneumonia control program have agreed on the need for this important national study and have contributed in no small way to the final version of the proposal, which has been submitted to the Federal Ministry of Health of Nigeria, as well as the UNICEF. The next stage is for funding commitments from the key stakeholders towards the carrying out of this proposal, and we look forward to this happening in the near future.
The theme for this year's World Pneumonia Day is Pneumonia Affects Everyone and is aimed at reducing death rates in the country. The federal government has set an agenda to dive into actions and prevention of pneumonia, especially in children.